This audio has been taken from the Citizens Archive of Pakistan's Oral History Project.
My sister and I grew up with the stories of partition. Um, so just around the time before partition was to take place, we were living in actually Mumbai, Bombay at that time, because that's where my father's family was. My mother was originally from Lahore, but after she got married, so she had moved to Bombay. Although both of them were educated, my mother was a matric, my father was a physician. So these stories were stories that we grew up with, and so we moved into we came to Karachi. My father relocated to Karachi sometimes after 1947. Um, and it was what was interesting was that he had in that during that time, if those who came into Pakistan often got a place, accommodation, and he was a physician. And there was a, a physician who moved, a Hindu physician who had moved to India, and my father was given this place in Karachi, which was at that time there was I think there was a cinema called Jubilee Cinema, which has since disappeared, but that building is still there, and my father practiced there, so we located to Karachi at that time. So my memories, I know that we went to a nursery school or whatever, and then my schooling was in St. Lawrence's Convent. Both my sister and I both went there. And the interesting part of it is that in those days, good education was, if you wanted to do that, you had to send your children, at least this is what I recall, to convent schools. So, so they were nuns. We were taught by nuns. And one of the interesting concern that my parents had, and they'd ask us periodically, कि तुम्हें वहाँ nuns जो हैं पढ़ाती हैं तो वो because there's always this thing कि वो Christians है तो Christians जो हैं वो और कुछ पढ़ाती हैं. My parents always had that concern, and they didn't. I mean, so I remember जब वो सुबह वो they would say a prayer, etc. The Muslim kids just stood there, etc. I really think that the nuns were dedicated teachers. They were from all over the place. Some had blue eyes, which was something that was novel to us. And St. Lawrence's, that's where really, in all honesty, I think my grounding for what I would become, it starts in school. So it was St. Lawrence's. Did matric from there. Then did 2 years of pre-medical medicine, FSC, which was in Central Government College for Women. And there again, and I finished that in 62. And then after that, 5 years of DOW Medical College. A great college, again, that essentially shaped me in my medical career. And which was, again, interesting, going back to those days, there was no college, medical college for just women. So Central Government College for Women, I did my FSC over there, and then it became an issue कि डाउ मेडिकल के अलावा और कोई जगह नहीं थी जहाँ सिर्फ ख़वातीन को पढ़ाया जाता था. So that's when I went into co-education, which of course now we have so many different colleges for women. Not in those days. During the time, the 5 years when I was in medical college, predating that, something interesting, why did I go into medicine and eventually went into surgery? Families have laws that come up. So I was told that my father, when I was born, and I was the first child, looked at my hands and said, these are the hands of a surgeon. I mean, sahi hai ya nahi, I don't know. But this was the thing. So after 5 years of medical college, when I graduated from there, I did a year of internship. And by that time, I had made up my mind I was going to be a surgeon. Parents जो है ना कहते हैं अभी भी आप अगर देखें कि बच्चा अगर कोई डॉक्टर बनता है तो माँ बाप कहते हैं हमने तो नहीं कहा था, ये तो इसकी अपनी डिसीजन थी, खुद इसकी मर्जी थी. But I remember when I was must have been 8 or 10, I was still in school. My father would take me to his clinic. It used to be called a dispensary in those days, and make me sit there as he was talking to and listening to his patients. And the patients didn't mind. He would just say, "Ki ye meri beti hai." And I would sit there and listen to that. He would oranges leke, then he would teach me how to inject an orange. So much for free choice that we think we have in life. So when I finished, graduated from DOW Medical, by that time I knew I wanted to do surgery. So I did a year of internship over here, and then I left for the United States. Preferred to go there. उस ज़माने में जो था, pretty much people who graduated from medical school went to UK. And the reason for that was because वो हमारे colonizers जो थे, we had picked up the educational system उनसे हमने लिया था. So और England करीब था और हमारे माँ बाप in a way बाप दादा थे. So most people would leave for postgraduate training के लिए England जाया करते थे. So अभी भी जाते हैं FRCS etc. अमेरिका नहीं जाते थे for a lot of reasons. एक तो it was much further off. It was a very different system of training. And the difference in those days was कि FRCS करने के लिए, which is a surgical degree that you get in UK, in those days, it's changed since, it was an apprenticeship. So you went there, if you got a good job with a good professor, to take it up, you did 6 months or a year, then you went to another professor. So it was like an apprenticeship. United States by that time, they had developed residency programs, which was very structured training programs where you were in the same accredited program for 5 years. So you didn't go around looking for professors to work with. Professors के साथ तो, old जो system था, professor था, you followed the professor around. But because the American culture is a little bit different, America the residency program they take you from year 1 to year 5. And during that time, they give you graduated, increasing responsibilities. So that 5th year you're really a seasoned surgeon under supervision. So in any case, so at that time, I think besides me, हमारी class जो थी DOW की, that may have been the first class, जिसमें से a few of us went to the United States for training. I was the only woman who went into surgery because that still remained. I mean, women did gynecology करती थी, pediatrics करती थी, which I found both of those. I mean, they're good fields, but I find them not very interesting for me. वो बच्चों को आप देख रहे हैं तो रोते जा रहे हैं, माँ बाप उनके हैं, उनको संभालें. Gynecology में हर साल वही खातून आ रही है to deliver again. So in any case, surgery was very definitive. You went in, made the diagnosis, hopefully did the right thing, the patient went home. So I went to the States, did my general surgery in 5 years. This was in New York. And during that time, I got interested in pediatric surgery, which is surgery that is specific to conditions in children. It was a new, नई वो specialty उस ज़माने में अभी निकली थी. In fact, जिस साल I started my fellowship to do pediatric surgery. After doing general surgery, you had to do that. You had to be an adult surgeon and have your boards in that before you went into pediatric surgery. So, in fact, just Sal, I went to pediatric to do my training in pediatric surgery. That was at the University of Florida in Gainesville. वो उस साल पहला एग्ज़ाम पीडियाट्रिक सर्जरी का अमेरिका में हुआ था. So from New York, I then went to to do pediatric surgery, University of Florida. That was 3 years. And then I stayed on there on the faculty of that university as a surgeon. So, and so I was in the United States until towards the end of 1985 is when I came back to Pakistan. And when I came back to Pakistan, I was ambivalent. I was doing very well there. I mean, by that time I was associate professor and I was due to become professor. So उस ज़माने में यहाँ Aga Khan University शुरू हुई थी. And you may know, the Aga Khan University was the first private university in Karachi. अब तो बहुत हो गई हैं, पर उस ज़माने में एक ही थी. So the medical college उन्होंने शुरू कर दिया था. Then in 1985 they were going to begin the hospital, and that's when they started looking for people to chair the department. And so the Shiva Smythe was the dean. Interesting guy, Texan tha. He contacted the chair of my department in Florida, and so he said, we have a surgeon here who's originally from Pakistan. So that was the connection. Shivas called me, I spoke to him. And this was in liberal United States. I'll tell you an interesting story, that's what this is about. So when Shiva Smythe contacted me, he said, can you come and meet me? I would like to interview you. So he was in Texas. So, so I said, sure. So I flew across to meet him, and that night he said, let me interview you. We'll go, there's this huge club, I guess, that he belonged to. So we'll have dinner there and I can talk to you over dinner. अब मैं जहाँ dinner पे पहुँची, तो वहाँ I sat there and वो menu उन्होंने ला के दिया. So मैंने अपने menu को देखा and I looked at it, and of course it was a very fancy club. तो उसके आगे prices नहीं थी. So I looked at Shivas and I said, Shivas, this is kind of interesting, nice menu, but why don't they have the prices? I had lived in the States for now close to 17 years. So Shivas laughed and said, oh, you don't need to look at that. I said, no, but I'm curious. And he said, the menu I have has the price on it. So I said, why? And he laughed and he said, the priced menu is given only to the men. I said, why? And he said, because generally they pay the bill. So I said, well, I'm sorry, you can pay the bill, but I want to know. So he called the waiter over. I said, excuse me, isme price nahi hai, mujhe dusra menu la ke do. So he looked at Shivas and he looked at me and he said, madam, this is the thing for you. I said, no, I want to know what the prices are. So can you please go and get me the menu? So Shivas started laughing, and Shivas said to the waiter, you've got a problem on your hand. And the waiter, with a very straight face, looked at Shivas and said, no, sir, you have the problem on your hand. But he got me So ये उस ज़माने में भी अमेरिका में, हालांकि this was now the 1980s, but these male clubs, etc., were there. The reason I raise this is I had become sensitive to this area for the simple reason I went into surgery and there were no women in surgery. None. So, meri sari training, I was there for 17 years. I trained in programs where there were no other females in surgery, none. All my people who trained me, the surgeons, were all men. There was no female surgeon who trained me, as if it was, that was how it was. There were no residents who trained with me who were women, they were all men. Um, when I went to the University of Florida for pediatric surgery and I was on their faculty for several years, there was not a single female surgeon on their faculty except me. And we trained no female residents during that time. So the reason this relates to the story with Shivas was I was very aware that वहाँ भी वो women's movements वगैरह शुरू हो गई थी. I was very aware of this sitting in a very liberal place with these insidious ways. वहाँ equal rights amendments का एक movement जो चली थी, I had gotten involved with that. And trying to get signatures on a petition from the male surgeons where I was like, they would look at you and say, you crazy. We're not going to sign this. So, us hisab se, at this point, America has moved forwards quite a bit. But I'm talking of the 70s and the 80s and comparing the two places. So, in any case, I was ambivalent about coming back. But because this was a new university and Karachi, Aga Khan University then, they called me for an interview. I came over, saw the place, and it had a lot of potential. I had tried in between, after I did my pediatric surgery, to come back to Pakistan. So मैं उस ज़माने में आई तो उस this was, I'm trying to think, maybe this was the year जब General Zia had just taken over. And मैं यहाँ आई and I looked for a place in pediatric surgery and they said कि हाँ लारकाना में you can go there. अभी हमारे पास hospital नहीं है but जो gynecology का जो operating room है you can use that. That was not doable. But the Aga Khan University was equipped enough and it had the infrastructure, etc., that I thought I could do that. So I returned towards the end of 1985 as professor and chair of the Department of Surgery at the Aga Khan University. And so that was my first life, and that was interesting. I came back into a department where besides me, there were 3 ya 4 or surgeons there, they were men, and I was younger than 2 of them. And I can understand the discomfort of a woman coming in surgery that was unheard of. America made the first chair of surgery who was a female in a university was Olga Johnson. And she became chair, I think it was a year after I took the chair position in the Aga Khan University. And I think it helped because there were good women there, and within the first, so we started our own training program. और उसके अंदर जो था, our first training program, which was general surgery में जो हमने शुरू किया था, the first graduates जो 4 थे उनमें से 1 was female. And within about 6 months of my getting there, we got Pakistani female surgeons on faculty. So in some ways, we moved much faster in that area than America did. But it was an interesting experience for me to be a female. And दूसरी चीज़, in all honesty, I had trained in an American system. I wanted to bring about changes, etc. So it was challenging, but a lot of fun. eventually, within the next 10 years, as chair. So our department went from, शुरू में जो 4 लोग थे, we went to about, at that time, around close to 30 surgeons in the department. Subdivisions ban gayi thi. So after 10 years, उस वक्त जो dean था, he was a Canadian dean, because हमारी training program in surgery was the best in the university. So he asked me, okay, we want to start a postgraduate medical education department. तो उसके अंदर जो था, so he asked if we need an associate dean for that. So then I spent 5 years as associate dean. So and that helped because we strengthened our training positions. बहुत सारे हमारे जो residents जो हमने train किए थे, अगर अब आप आगा खान यूनिवर्सिटी में देखें, now it's so many years subsequently, a lot of the top positions were then subsequently taken by people who we had trained through our programs. So they were indigenously trained people. So I think it was a challenge, and I've also always felt that for women, when you break into male-dominated professions, कोई भी आप ले लें, शुरू में it's a little difficult because you're a newcomer. I mean, you know, and I can understand that. So the men look at you. So initially, जो pressures जो होते हैं, you have to prove yourself. And I think that still works. As a woman in a male field, you have to prove yourself. But the nice thing is it's very easy to do. I mean, for women, if you put your mind to it, it's easy to be better than men. And I'm convinced of that. Once you do make that position and you have to work at that, then you have far more opportunities because you gain the respect of your professional colleagues, etc. So I was in AKU. I left AKU. I resigned from AKU in a year before the turn of the century because I left and went back to the States in 2000. And the reason for that was, and that was the start of my new life, which is in bioethics. And it's while I was in AKU, and it was a great experience building up the department and then the postgraduate medical education department. What I found was that surgically I was doing nothing different in AKU as I was in the States. But once I left the operating room, I entered a world which was very different. It was a world I had left behind and gone off to the States. And that was the cultural, social, economic world, which was very different from the States. And so the interaction, my interaction with families, etc., was completely different. So for example, States में, they would call me Dr. Moazam. जो बच्चे आते थे, my pediatric patients, they were told, say good morning to Dr. Mo, they used to call me. यहाँ जो होता था, parents कहते थे, Dr. Auntie को सलाम करो. So that was the first thing. It was a relational kind of ethics that I was, relational moral sense. So जो माँ बाप थे, they would look at me and they would say, आप हमारी बड़ी बहन की तरह है, या आप हमारी माँ की तरह है. Also, this was said often by people who would have been older than me. आप हमें बताएं, हम ये इसमें क्या करें. And this was something I had never heard in the United States. So there was a moral sense, or for patients to look at me and say कि ऊपर खुदा है और यहाँ आप हैं, was something I had never heard in my practice. Now, what that did was I gradually became interested in looking at this aspect. I mean, operating room method, that was a skill, it was the same. And that's what got me interested in the ethics or the morality of the medical profession. It was something I didn't know anything about, so I started reading more about it. And then I went to and I did an intensive course again while I was still in AKU in Kennedy Institute on ethics, etc. Took a sabbatical and went to the University of Virginia for a year. And I went there to audit stuff because what I was getting interested was कि वहाँ भी अमेरिका में भी moral world है, यहाँ भी moral world है, but there are differences between the two. So I went to the University of Virginia for a year, went there to do auditing and to audit courses on ethics, philosophy, religion, because all that ties into ethics, and ended up doing a master's in bioethics. So, so my interest had grown. So in 2000, I resigned from AKU. I think people were not very happy about it because I had made a lot of friends, etc. And this time I went to the University of Virginia to get my PhD in, with a focus on cross-cultural ethics, and I did that through the Department of Religious Studies in UVA. And I just loved it, loved the time I spent there. और उस दौरान because I was, quote, an adult student, Jim Childress, who's the doyen of contemporary bioethics, was my supervisor. And so Jim and Jim had known me from the courses I'd taken before. He was a very good supervisor. He gave me freedom to do what I wanted to do. And what I did over there was that so much of religion is part of our moral life in Pakistan that I took courses on the history of religions, especially Muslim religions, the Muslim philosophers, Muslim ethicists, Muslim physicians historically who had looked at codes for doctors, etc. So that was an area I focused on. And I went to, did 3 months in Jordan in summer for an elective. It was awful. बहुत गर्मी थी. To learn Arabic. And that was in order to be able to look at some of these sources myself. So I'm not an expert, but within, अगर Imam Ghazali या कुछ ऐसे देखना हो, with the dictionary in his writings, I can now kind of pick up the stuff. Because हमारे पास हमारी जो religious चीज़ें, even Quran शरीफ भी जो है, वो translated हमें मिलता है. But Arabic, though, it's a very rich language. एक लफ्ज़ के इतने मायने निकलते हैं कि जो you, when, like any book, what you read, you bring your own worldview to it and how you interpret it. So in any case, so I did that, and while I was there in the States, my thesis के लिए, I came to, and that's when I got interested in anthropology, because I was now in social sciences. I was now in a different world. I was not cutting, sewing, etc. But I was getting into the experiential parts of medicine and how patients and families react. तो उस ज़माने में for my thesis, there was a lot of organ donation की बातें उस ज़माने में हो रही थी. And so और यहाँ भी पाकिस्तान में भी था कि we need to do this. So the courses that I took in the United States on the ethics of organ donation, यहाँ का what I knew about it, it was how families decide to give organs, etc., what is their motivation, I felt was different. So I came and did my research for my thesis in SIUT, the Sindh Institute of Urology and Transplantation. और यहाँ के and this was three months of it was anthropological work. Again, I was an observer and participant. And Dr. Adib Rizvi, who's the director of SIUT, he's an icon himself. तो मैं यहाँ बैठ के जब research करती थी, I would take interviews वगैरह, रात को बैठ के they had given me an office where I could work. So Adib Saab would come and sit down and he said, आज क्या किया? And I would tell him कि ये किया. He would tell me stories about then some of his patients. So मेरी thesis जो थी, this was published by Indiana University Press. उसमें a lot, it was anonymized, but it was about my research over here. So Adib Saab then said कि I think ये हमें यहाँ भी ज़रूरत है ethics की, Pakistan. And I laughed. You know, I had gone there with no idea. So a year before I finished my my PhD, Adib Saab was at a conference in Boston. उस ज़माने में Dr. Amir Jafri, who was my resident in Aga Khan University, had also gotten interested in bioethics, was in Boston doing a fellowship at Harvard. So we met in Adib Saab in a food court in Boston. And Adib Saab, that's where the issue of the center came up. So I said, okay. And so Amir and I sat on the footstep, on the medical college ke bahir in UVA mein, steps mein, because there's no center like that in Pakistan. But in any case, that is how the Center of Biomedical Ethics and Culture, this is my second life, in SIUT, was inaugurated in October 2004. So I was still finishing my dissertation, but Dr. Amir had returned. So he came here and he and I were on email. Adib Saab said, okay, ye space le lo, wo space dekho, etc. So Amir would communicate with me. I actually finished finished my dissertation. I arrived here in April 2005, the next year. And that's when we started the center.
This audio has been taken from the Citizens Archive of Pakistan's Oral History Project.